Good morning, my name is Gauss Jonamisi Kaimer from BSN 212F Grade 22, and today I will be performing the intradermal administration. So the purpose of this is to provide a medication that the client requires for allergy testing and TB screening. So first, for the general preparation, we have to check the doctor's order because this chart is more reliable than the medication ticket. And the next is we are going to check the MAR or the medication administration record to make sure that the correct medication is being prepared. And also we have to check the label on the medication carefully against the EMAR to make sure that the correct medication is being prepared. So we also have to follow the three checks for administering medication. First is when it is taken from the medication cart. The next is before withdrawing the medication, and also after withdrawing the medication. This is to ensure that we are giving the right medication with the right dose to the right client, and to make sure that we are administering the right route. And lastly is we are also going to organize the equipment to save time and energy. So prior to going here, I had already checked the medication along with the MAR to check the label of the medications that are needed. And also now before we withdraw the medication, I will check now the medication together with the MAR. Okay. So now we are going to in preparing the medication in vial, we are going to perform hand hygiene and also observe any other appropriate infection prevention to deter the spread of microorganisms, and also we have to use gloves to protect ourselves from any cross-contamination. And since I had already done my hand washing earlier before going here and also hand hygiene, I can now wear my clean gloves. So now we have to prepare the medication vial for drug withdrawal. So first, we are going to mix the solution if necessary, if there is, by rotating the vial between our palms and not by shaking. So we are going to do this because some vials contain aqueous suspension which settle when they stand. And in some instances, shaking is contraindicated because it may cause the mixture to foam. Now we're done. Rotating the vial, we have to remove the productive cap and clean the rubber cap of previously opened vial with an antiseptic wipe by rubbing in a circular motion, because the antiseptic will clean the cap and reduces the number of microorganisms. So as if that I am opening the vial, and then using a antiseptic swab, I'm going to clean it in a circular motion. And then discard. And then the next thing we are going to do is we have to withdraw the medication. First is we are going to attach a filter needle as a agency practice dictates. So draw up premixed liquid medication from multi-dose vials. By using a vial or filter needle prevents any solid particles from being drawn up through the needle. And also we have to ensure that the needle is firmly attached to the syringe, because any loose attachment of needle will not draw the medication properly. And then after that, we have to remove the cap of the needle. So I'm going to open the filter needle and set it aside first, and then get the syringe. So this is a tuberculin syringe. Then set aside. Then we have to attach and then we have to remove the cap from the needle, then draw up into the syringe the amount of air equal to the volume of the medication to be drawn. So we have, after withdraw the after we draw the enough amount, we have to remove the cap. And then next is we are going to carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. And then now let's And then after that, we are going to inject the air. Inject the air into the vial, keeping the bevel of the needle above the surface of the medication, because the air will allow the medication to be drawn out easily. Because negative pressure will not be created inside the vial, the bevel is kept above the medication to avoid creating bubbles in the medication. And then we are going to withdraw the prescribed amount of medication using either of the following methods. Either we have to hold the vial down with the base lower than the top, and then move the needle tip so that it is below the fluid level and withdraw the medication, because keeping the vial in the upright position while withdrawing the medication allows particulate matter to precipitate out of the solution. And also, the next technique is to invert the vial, because we have to ensure the needle tip is below the fluid level and gradually withdraw the medication, because this will prevent air from being drawn into the syringe. Okay. Now after getting this, we are going to recap it and then discard the filter needle and place it with the regular needle. And then we have to put this in the medicine tray before, and since after withdrawing the medicine, the medication from the vial, we are going to again check it from the MER to ensure that we have gotten the right dose and the right drug. So since it's the name is in here, and we also have gotten the right dosage of the medication. So now we can go to the room's patient. So now, since I am done preparing the medication and also doing the general preparation, we can now proceed with the intradermal administration. So prior to doing the procedure, we are going to introduce ourselves to the patient and verify the client identity by doing the agency protocol that we have to ask for the name and her birthday. And then afterwards, we are going to explain the procedure that we are going to do, and also explain to the client that the medication will produce a small wheal, sometimes called a blag, because a wheal is a small raised area like a blister. The client will feel also a slight prick as the needle enters the skin. So any information can also facilitate acceptance and compliance with the therapy. So, hi ma'am, good morning. My name is Dr. Missy Camille, your student nurse for today. May I see your wristband, ma'am? Can you state your complete name?
Rose Rivera.
And your birthday, please?
October 1, 2001.
Okay, thank you. So now, ma'am, your physician has ordered a penicillin skin test, and I will inject a small amount of penicillin in the skin of your forearm. And so with that, we will be able to know if you are allergic in the penicillin. Would that be alright, ma'am?
Mm-hmm.
Okay, so after the injection, ma'am, expect that there will be a bleb or a raised area of your skin after I inject this medication to you. It is just like the bite of a mosquito, in which there will be a small raise in your skin once you rub it. Okay? Okay. So next is we are going to provide for client's privacy, to provide a secure environment for the client and also maintain her dignity. So let me just pin the patient. And then we have to select and cleanse the site. Select a site, example the forearm about a hand's width above the wrist and 3 or 4 fingers width below the antecubital space. So selecting the correct sites allows for accurate reading of the test site at the appropriate time. So let me put your arm on the table. Okay, so we are going to inject the medication here in this area. So I'm going to inject the medication here, ma'am. Alright. And so we have to avoid using the sites that are tender, inflamed, or swollen, and those that have any lesions, because sites should be free from lesions, rashes, and moles. And then after that, we have to apply gloves as indicated by agency policy. We have to cleanse the skin at the site using a firm circular motion, starting at the center and widening the circle outward, and also allow the area to dry thoroughly, because cleansing the injection site prepares it for the injection, and this method will also remove pathogen away from the injection site. Okay, since I have done my performing hand washing earlier prior to going here, I can now wear my gloves. And then we have to cleanse the site with an alcohol swab from the center and into the outer in a circular motion. And then discard. And then afterwards, we are going to prepare the syringe for the injection. First is we are going to remove the needle cap while waiting for the antiseptic to dry, because alcohol gives full play to disinfect after dried. And then we have to expel any air from the syringe, because small bubble adhered to the plunger are no consequence, because small amount of air will not harm the tissues. So upon checking, there are no any bubbles or air in the inside the syringe which the medication is being stored. And then we are going to grasp the syringe in our dominant hand close to the hub, holding it between the thumb and forefinger. Hold the needle almost parallel to the skin surface, with the bevel of the needle up, because the possibility of the medication entering the subcutaneous tissue increases when using an angle greater than 15 degrees. So it should be at least 5 to 15 degrees. And then after that, we are going to inject the fluid. So can we hold this one? So with the non-dominant hand, we have to pull the skin at the site until it is taut. For example, if using the ventral forearm, grasp the client's dorsal forearm and gently pull it to tighten the ventral skin. So we are just going to do like this, like this one, because taut skin allows for easier entry of the needle and less discomfort for the client. And then we are going to insert the rib of the needle far enough to place the bevel through the epidermis into the dermis, and then we have to withdraw the needle afterwards. Bevel up, so in a 5 to 10 and 15 degrees, insert. Okay, so we are going to withdraw the needle quickly at the same angle which it was inserted, because afterwards we can also put or apply a bandage if it is indicated. And because low needle, withdrawal may be uncomfortable for the client, and so with this we are going to dispose it. And then we should not massage the area or the injected site, because massage can disperse the medication into the tissue through the needle of the injection site. And then we have to remove and discard gloves. We should not recap the needle in the order to prevent needle stick injuries. So that's why I have, after I remove the syringe to the skin, I already discard it afterwards. And then we have to remove our gloves since we are done, and then discard it. Then perform hand hygiene, prevent any cross-contamination, and also to protect ourselves. And then also we are going to, afterwards, we're going to encircle the injected site with ink to observe for any redness or induration of hardening per agency policy to allow easy identification of injected site. So, going to encircle the injected site. And then we have to document all relevant information, records the testing materials given, the time, the dosage, route, site, and also the nursing assessment, because documenting data serves as a legal evidence that we have conducted the medicine administration and also form a communication between the healthcare professionals. So I am going to document the medicine that we had administered, the time, the dosage, the route, and the reaction of the patient during the administration. And then afterwards, we are going to evaluate the condition of the site 30 minutes depending on the test. So we have to measure the area of redness and then duration in millimeters at the largest diameter and document findings. Because some medications used in testing may cause allergic reactions, epinephrine may need to be used. Then we, after evaluating, then we have to document if the client had a positive or negative skin test result, follow the agency protocol and labeling of allergies to avoid any potential errors from the unintended repeated dose. So assuming that it is already 30 minutes later, I have to now to evaluate the injected site, which I had already marked with a pen. So let me see it now. Okay, so since there is no redness and inflammation, the patient may is negative in penicillin allergic test. So now, ma'am, upon observing in the injected site which I had encircled earlier 30 minutes ago, there is no any swelling or inflammation and also redness in the site, which you're not positive in. You're not allergic in penicillin medication. So now that I'm done, and I'm going to leave the patient and let her rest, and that's all. Thank you.